Welcome to our channel, HASHMICLINICS.
Welcome. In our vast Materia Medica, some remedies really stand out for their sheer intensity. And today, we're going to delve into one of those, Anantherum muricatum. It's a powerful tool, for sure, for addressing these deep, destructive pathologies that often leave us searching for the right answer.
Just think about that for a second. Imagine a headache so intense that it feels like a physical assault. Right there, that's the world of Anantherum muricatum. This one signature sensation gives us our very first clue into just how invasive and profound its nature really is.
So, what is it? Well, it's derived from an East Indian grass. You'll probably know it as vetiver. And Anantherum's core action, its whole reason for being, is to address severe pathology. We're talking stuff that's often rooted in those deep, inherited miasms, those underlying chronic disease tendencies. Think of it like a relentless process that just breaks down tissue, from the glands all the way to the skin.
To really get a handle on this remedy, we're going to build a complete clinical picture together. We'll kick things off with its core essence, then we'll explore its really unique mental and physical symptoms, and finally, we'll get practical with how to apply it, and maybe more importantly, how to differentiate it in your practice.
Okay, so let's start at the very core of it. What is the fundamental signature of this remedy? What does it actually do in the body?
This right here, this perfectly illustrates the relentless march of Anantherum towards tissue destruction. It's a really clear four-step process. It all starts with a painful swelling, especially of the glands, which then harden up, they become indurated. But it doesn't stop there. It keeps going, progressing to suppuration, forming abscesses and boils, and then finally breaking down into open ulcers. This destructive pathway is a central theme we're going to see over and over again.
Now, let's see how this physical breakdown is mirrored in the mind. It's fascinating, really. The same disintegration that we're seeing in the tissues, it also shows up in the personality itself.
And this is a classic example of a contradictory state that should immediately make you think of Anantherum. On the one hand, you've got this almost manic joy, this foolish laughter, and on the other, a deep, isolating sadness. This oscillation, this swinging back and forth between two extremes, is a powerful keynote.
And beyond just that duality, we find these really peculiar and unforgettable symptoms. We see a real decline in cognitive function, a blunted intellect. The person can be incredibly quarrelsome, only to be filled with regret moments later. You might even see monomania, a fixation on a single, often bizarre activity. And clinically, pay very close attention to this sexual symptom, a desire that is only inflamed, made worse by attempts to satisfy it, sometimes even driving the patient to madness. This psychological profile is so unique, it's a really strong indicator for the remedy.
Okay, now that we have a grasp of the mental picture, let's trace how this central disturbance shows up throughout the body. We've seen the general destructive process. Now let's look at its specific targets.
The skin is an absolute primary battleground for Anantherum. In fact, it's considered a skin remedy of the highest order. We're seeing abscesses, boils, and deep, foul ulcers. The erysipelas is also really characteristic. It's a dark red or even bluish color, with a pronounced tendency to suppurate. It's just a very unhealthy, destructive skin process.
Anantherum has a profound impact on the nervous system. The neuralgias are severe, often producing these convulsive tics, especially in the face, a classic tic douloureux. The quality of the pain is what's so distinctive, and it's often the deciding factor in a prescription. We're talking a crushing sensation in the facial bones, or, like we saw at the very beginning, like sharp arrows piercing the brain.
These specific, unusual physical signs, these are often the crucial pointers that are going to confirm your prescription. The tongue is one of the most reliable keynotes. It looks fissured, almost as if someone took a knife and just cut its edges. When you see this, especially when it's combined with profuse salivation and debility, Anantherum has got to be at the top of your list. We also see those signature glandular swellings, severe cystitis, and even issues at the body's periphery like deformed nails and a characteristically foul foot sweat.
All right, on to the modalities. And as we all know, understanding the circumstances that trigger, worsen, or improve a patient's state, that's the key to refining our prescription and differentiating between really similar remedies.
So this table gives us a pretty clear roadmap of the Anantherum patient's sensitivities. Notice the classic aggravation in the afternoon and at night, and that sensitivity to sensory input, motion, noise, light. The relationship with coffee is also a bit of a peculiar one. You get an initial aggravation followed by relief. And don't forget that specific modality for deafness. It's definitely worse in damp weather.
All right, this is where clinical mastery really gets tested. Anantherum shares features with several major polycrests, so let's take a minute to distinguish it from the remedies it's most often confused with.
So both of these remedies have that copious salivation, glandular suppuration, and a deep syphilitic miasmatic background. You might be thinking, well, how do I tell them apart? But the distinction is often right there in the mouth. While both can have foul breath, Anantherum's tongue is uniquely fissured, cut on the edges. Mercurius, on the other hand, has that classic flabby, moist tongue that shows the imprint of the teeth. That signpost is pretty definitive.
Now, both of these are powerful psychotic remedies, but they represent completely opposite pathological movements. Just remember this: Anantherum breaks tissue down, it destroys, it suppurates, and it ulcerates. Thuja, on the other hand, builds tissue up in a disordered way, producing things like warts, condyloma, and other growths. One is destructive, the other is proliferative. Simple as that.
Both of these can present with intense neuralgia and skin symptoms, for sure. The causal factor, though, is the key here. Anantherum's pains come from its core destructive, miasmatic nature. Staph aureus pains, in contrast, frequently stem from a very specific trigger: suppressed anger, indignation, or a history of sharp, cutting injuries, like surgery. You've got to look to the etiology to separate these two.
All right, let's bring it all home. How do we take all this knowledge and actually apply it in our clinical practice? What are the key takeaways that will help us spot this remedy when it walks into our clinic?
You know, if you see a case that's defined by this constellation of symptoms, tissue breakdown, a deep miasmatic load, that signature tongue, and intense neuralgia, you absolutely have to consider Anantherum. The combination of these features creates a picture that's really hard to mistake for anything else, and it's a remedy that can bring about profound healing.
Remember its profound ability to resolve these severe suppurative skin and glandular affections. It's truly an invaluable tool for some of our most challenging cases.
So I'll leave you with this question. The goal of this whole explainer is really to encourage you to apply this knowledge, to explore the clinical potential of this powerful, deep-acting remedy. The next time you see that destructive march of pathology, remember those pointed arrows, remember the fissured tongue, and think of the profound relief Anantherum can bring. Will you consider it?
Professor Dr. Rafat Hashmi is a distinguished homeopathic physician, educator, and researcher with over 4 decades of clinical and teaching experience. He is widely respected for his deep command of Materia, Medica, repertory, and constitutional prescribing, combined with a practical, patient-centered approach. Dr. Hashmi has dedicated his career to training generations of homeopathic doctors, blending classical principles with modern clinical insight. He is also known for his innovative work in digital homeopathy, developing educational content, clinical tools, and AI-assisted systems to enhance remedy selection and case analysis. With a strong commitment to ethical practice and lifelong learning, Professor Dr. Rafat Hashmi continues to guide, inspire, and elevate the standards of homeopathic education and patient care.